HPV vaccines available in India are basically of two types. One is the bivalent vaccine which is effective against HPV 16 and 18, which are the most common strains for cancer. Whereas the quadrivalent vaccine, quadrivalent as the name says, is important for 4 strains. It is effective against 4 strains, 611 which are forming the benign warts, and 16 and 18 are the malignant ones. Now, bivalent vaccine are available in the name of Cervarix, which is produced by GSK, and the quadrivalent vaccine which is imported from outside is Gardasil. It is the product from outside India and is produced by Merck company, whereas now we have the made in India product in the name of Servavac, which is an Indian product by the Serum Institute of India, which will be launched very shortly. Now, these are the HPV vaccines which are available. You should remember we have a nonavalent vaccine also, which will be available for boys also. It is for boys as well as girls. So, it will cover all the 9 strains of vaccine, that is the 6, 11, 16, 18, these you all know. Then you have 31, 45, 52, 58 and etc. All the 9 valent of vaccines are also available. Now, what is the age for which it is licensed? The licensed age in India is, remember, it is from 9 to 45 years. This means between 9 to 45 years people can have the HPV vaccination done. But what is the target age group? What is the target or the preferred age group? Preferred age group is between 9 to 14 years. 9 to 14 years is the preferred age group, because we have to give the vaccination shot before the female becomes sexually active, so that we prevent HPV infection. And you have a catch up group also, because many of the females between 9 to 14 years are not brought for vaccination and then they are left out. So, between 15 to 26 years is the catch up vaccination age group. Now, in the target age group we generally give 2 doses of the vaccine. 2 doses of the vaccine are enough. In the catch up group and beyond this you need 3 doses of the vaccine. Now, when 2 doses are given, what is the dose? Preferably it is 0 and 6, means you give today and after 6 months you give the second dose. Whereas, in the catch up vaccination group, or when the age is more than 14 years, then you give 3 doses. Now, it depends on what type of vaccine you are giving. If you are giving the bivalent one, that is Cervarix, bivalent one, then you give at 0, 1 and 6, means today, after 1 month and then after a total of 6 months. And if you are giving quadrivalent vaccine, then you give 0, 2 and 6, means today, then after 2 months and then after 6 months. So, basically we are giving now quadrivalent vaccine in the form of Gardasil or Servavac. So, basically our doses in the target age group will be 0 and 6, whereas our population in 15 to 26 years will be taking at 0, 2 and 6 months. So, this is to be remembered. Now, what is the minimum and maximum duration between 2 doses? So, the minimum duration when 2 doses are given is 6 months, of course. Okay. Before 6 months, no need to take the second dose, and the maximum duration can be extended up to 12 to 15 months. So, remember, if a patient forgets after 6 months, it is not that after 7 months she cannot take the vaccine, but 12 to 15 months, up to 12 to 15 months she can take the vaccine. Then comes some of the special situations where we should go for what type of vaccination and how. Suppose you have an HIV positive patient, okay, or an immunocompromised patient, like she is SLE and she is immunocompromised. So, she will come to you and ask you, how should I take the vaccination? Remember, this is the same as non-immunocompromised patient. The recommendation is the same as per age group, but preferably give 3 doses even if age is less than 15 years. Preferably give 3 doses because you have to induce immunity. Next is if a patient has become pregnant, okay, after vaccination. So, should we go for MTP? No, it is not an indication to go for MTP, but however, pregnancy is a contraindication for HPV vaccination because it is a live vaccine. So, if a pregnancy is known, then you will not give HPV vaccination, but if patient has taken 1 or 2 doses of HPV vaccination and then she has become pregnant unknowingly, then you need not to go for MTP, you have to go for aneuploidy screening and then ultrasound, level 2 ultrasound in a proper way, but till now there is no documentation of aneuploidies or any kind of congenital malformations. Then what happens, suppose a victim of rape case has come to you, victim of rape case, like suppose POXOs land up in our hospitals very often, then during the examination we can counsel her for HPV vaccination and we can give the first dose of HPV vaccination. Okay. So, this will suppose the first coitus has taken place, but still this is an opportunistic measure where we can give, and these age group, these smaller age group girls can be taken advantage and HPV vaccination can be given. Then women with CIN1, suppose a woman comes who has abnormal CIN report. So, can she go for this cervical cancer vaccination? The answer is yes, they can go. We can counsel them that there is reduced efficacy after since you are already CIN1, but then there are limited evidences which say that the progress of the disease is prevented after giving HPV vaccination. This means a women with CIN1 may have lesser progress to CIN2, 3 and then frank carcinoma cervix if you give them. So, they are also candidates for vaccination provided the age is the same. Coming to males, male population can have to take HPV nonavalent vaccine as bivalent and quadrivalent vaccine are not applicable for them. So, and one more very important question which people come and ask is, suppose it is an interrupted dose. Interrupted dose means I have taken the first dose, second dose was after 2 months I have taken, and third dose I could not take after 6 months. So, what should I do? The moment she remembers, take the third dose. Suppose first dose I have taken and then second dose I remember after 4 months, or I did not have money, I could not take Gardasil and I came after 4 months. So, what I will do is I will give the second dose whenever she comes and the third dose will be planned accordingly. That is, if it was 0, 2 and 6, if it was 0, 2 and 6, so 4 months was the minimum gap between the second and the third dose. So, whenever she comes, if she comes at 4th month, I will give the second vaccine at 4th month and then at 8th month I will give the third dose. So, similarly, you have to weigh the risks and benefits and you have to explain to the patient. So, this is all about HPV vaccination. I hope you have understood it. And always remember, HPV vaccination is a primary prevention. So, our aim to eliminate HPV and to eliminate cervical cancer campaign is ongoing. So, thank you so much for listening.